Diabetes is a chronic condition characterized by high levels of sugar, glucose in the blood. It occurs either because the body doesn't produce enough insulin, a hormone that helps regulate blood sugar, or because the body doesn't use insulin effectively. There are several types of diabetes. Type 1 diabetes. This is an autoimmune condition where the immune system attacks and destroys the insulin producing cells in the pancreas. It typically develops in childhood or adolescence and requires lifelong insulin therapy. Type 2 diabetes. This is the most common form of diabetes, where the body either becomes resistant to insulin or doesn't produce enough. It often develops in adulthood, but rising rates in younger population are linked to factors like obesity, poor diet, and lack of physical activity. Gestational diabetes. This type occurs during pregnancy and usually disappears after childbirth. However, women who have gestational diabetes are at higher risk of developing type 2 diabetes later in life. Other types. There are also less common forms of diabetes caused by genetic mutation, certain medications, or other conditions. These are rare. Uncontrolled diabetes can lead to serious complications such as heart disease, kidney damage, nerve damage, and vision problems. Managing diabetes typically involves lifestyle change such as a healthy diet and regular exercise. Medications including insulin for some and monitoring blood sugar levels. Treatment goals focus on maintaining blood sugar within a target range to prevent complications and improve overall quality of life. The symptoms of diabetes can vary depending on the type and whether blood sugar levels are well controlled. Common symptoms of both type 1 and type 2 diabetes include increased thirst, polydipsia, feeling thirsty more often than usual, frequent urination, polyuria, needing to urinate more often, especially at night, fatigue, feeling unusually tired or weak, even with sufficient rest, blurred vision, difficulty seeing clearly, which can happen due to changes in fluid levels affecting the eyes. Unexplained weight loss, losing weight despite eating normally or even more than usual, particularly in type 1 of diabetes. Increased hunger, polphagia, feeling excessively hungry even after eating. Slow healing, sore or cuts, wounds or infections that take longer to heal, tinglings or numbness in hands or feet. This can be a sign of nerve damage, especially in people with long-term uncontrolled diabetes, neuropathy. Dry skin. Skin can become dry and itchy, often due to dehydration. Frequent infections increase susceptibility to infections, particularly in the skin, urinary tract, or gums. In type 1 of diabetes, these symptoms may develop more suddenly and severely in type 2 diabetes. Symptoms can develop more gradually, and some people may not notice any signs until complications arise. If you experience any of these symptoms, it's important to see a healthcare provider to proper testing and diagnosis. Well, teacher and classmates, and that's all for my part. Thank you.
Common symptoms of diabetes: increased thirst, feeling unusually thirsty and needing to drink more liquid. Frequent urination, urinating more than often usual, especially at night. Fatigue, feeling more tired than usual, even after rest. Blurred vision, high blood sugar levels can affect your eyesight. Unexplained weight loss, losing weight without any apparent reason, even when eating more. Slow healing wounds or infections. Frequent infections and wounds that are longer to heal are common people with diabetes. Excessive hunger. Feeling constantly hungry even after eating, dry and itchy skin. High blood sugar can cause dry, itchy skin, numbness of tingling in hands or feet. This can be caused by nerve damage related to diabetes. There are several key risk factors for developing diabetes that we need to consider. First, being overweight or obese is one of the biggest factors. Extra weight, especially around the abdomen, increases the likelihood of developing insulin resistance. A sedentary lifestyle or not getting enough physical activity also contributes to the risk. If you don't exercise regularly, your body may have trouble regulating blood sugar levels. Another important risk factor is family history. If you have a parent or sibling with diabetes, your chances of developing it are higher. Genetics can play a significant role in determining whether or not you will develop the condition. Age is also a factor. People over 45 years old are at greater risk, but that doesn't mean younger people are immune. Your risk increases as you get older. Diet plays a crucial role too. Eating a diet high in processed foods, sugary drinks, and unhealthy fats can lead to weight gain and increase the chances of developing diabetes. A poor diet can also make it harder for your body to process sugar efficiently. Other health conditions like high blood pressure, high cholesterol, and sleep apnea can raise the risk of diabetes as well. Lastly, if you had gestational diabetes during pregnancy, you're more likely to develop type 2 diabetes later on. Managing weight, staying active, eating nutritious food, and controlling other health conditions can all help reduce your risk for diabetes.